Hey everybody, I'm Lee Cade. This is a VTV COVID update. It's replacing our regular VINI podcast for today, and for good reason. Last night at 9:30 p.m., Governor Gary Herbert announced a state of emergency and expanded COVID mandate for the first time since the epidemic started, a mask mandate. Today, to go over the details of how this changes operations within Valley Behavioral Health, and in general, how we should be approaching changes for our own lives, is Chief Operating Officer Becky Brown. Hi, Becky.
Hey, Lee. Thanks for having me.
Well, another big burst went out last night with the governor basically stating a new state of emergency and a mask mandate for the next 2 weeks. Did you want to go into details on that?
Yeah, so we've received an executive order for a statewide mask mandate, gatherings limited to same household only for the next 2 weeks, no youth and high school sports and activities, masks and physical distancing between household groups at all businesses, including bars and restaurants, and then weekly testing on college campuses. For us in Valley, it doesn't change a lot, but we have been requiring masks in all locations. But I would say that I do think it is a good reminder of where we are. Our hospital capacity is over 100% at this point.
Oh, wow.
Our healthcare workers are becoming very, very tired and fatigued. I think they talk about we can make tons of hospital space. We can open up a space down south at the Mountain America, the Expo Center, but we don't have the healthcare workers to do that. And I know for sure if I need to have ICU type treatment, I want somebody that's trained to work in the ICU. I don't want somebody who's a pediatric provider who gets called in. And so I think that that is something that they're really trying to curb right now, especially as we get into the winter months and we've seen such a strong uptick in cases. And within Valley, we have seen a very, very sharp uptick in cases with our staff, with leadership, and with our clients. And so we have a responsibility to make sure that our masks are on and they're over our noses and that they are on at all times in all settings. I've received word about a couple of case managers who had been out working with clients and moving them into their homes, and they didn't think because they were not on campus for Valley that it was required to be wearing masks. And unfortunately now we're in a situation where there has been COVID spread. And so I think in all settings at all times, but it's also a good reminder just in all settings at all times with our families. Mm-hmm. So I think the governor is saying what they have found is that the spread is not happening in businesses and in restaurants. The spread is happening when we're getting together with our neighbors or getting together for small family gatherings. And I think it is going to only become more prevalent. My family had a family activity and we all masked. And there were some people that were not comfortable with that, and now we won't be doing that. So the requirement now is that there's no gatherings outside of your household for the next 2 weeks. Those statements are hard, but with what we're seeing and the illness spreading, I think it's really for the best for our teams.
And one of the reasons why they're testing students on campus is because younger people are asymptomatic. They may be actually carrying COVID, but not showing any symptoms at all. So they're going about their business as usual. Or in some cases, like in Utah County, where several thousand people show up for an unmasked party. And that's a super spreader event, right? So
yeah, and they will, on that note, they will be now, I noticed one of the mandates that came out is that they will be charging $10,000 per occurrence for large gatherings. To me, in my opinion, essential at this point that there is a consequence.
Well, and I know we hate to see that, but when you get to the point where people are being irresponsible personally, then we do have to maybe drop that hammer from time to time. How does that change operations within Valley, if at all? We've already been masking. We've already been suggesting, actually requiring that people wear masks, but we're seeing so much spread in so many cases right now. And this is really bad for our vulnerable clients. I know we've been talking with some of our therapists and attending clinicians that work with SRS, and they're saying that COVID's been absolutely devastating with our population. I know with masters, an outbreak of COVID could be catastrophic. So what are we looking at here?
So it doesn't really change a lot with the operations that we have been doing already. We have been very mindful. We have kept group sizes very small. We have required masks and social distancing in all settings. What we will do is restrict any outside visitation for our residential and housing units, which is an impact. And I think, for SRS, it's impactful, but for our housing and residential programs, as we go into the holidays, we're trying to figure out how to work around some some of the complexity related to how do we visit with family? Do we put tents up outside? But the thing is, if we don't get the spread under control, we won't be able to create opportunities for visitation because it would be way too risky. And so now before the holidays is a really great time for us to just kind of like hold on, try to get things under control. If we can get the rate of transmission down and the number of positive tests down, we can be in a safer place. When we look at that rate of transmission that's up close to the 20% positivity rate, and then the rate of transmission being up around 1.13, we need that under 1 to know that we're going to start to see a decrease. So those are the numbers that we monitor closely. And it is catastrophic. If we were to have a case of spread within one of our housing or residential programs for the populations that we treat, it could be catastrophic. Our teams have done a really great job. And the interesting thing that we're seeing right now is the bulk of the spread is happening with our employees and employee to employee, because people are becoming fatigued and somewhat careless in their interactions and maybe not paying attention to having your mask all the way up over your face. And we're tracking those cases closely, and we really want to make sure that people remain safe, but the employees are more likely to bring cases into the populations that we're serving at this point than anyone else.
That's hard, and hopefully people will buckle down. I know the strategy from the state is to limit interaction to within the household. And the hope is that if we do this for 2 weeks, then maybe we can loosen some of these restrictions in time for Thanksgiving. But we're even talking, if you go to a restaurant, just go with your family. Don't meet up with your friends. And I know part of that strategy is if we can limit the spread, bring that number down, then we can continue to keep masks, but that doesn't mean businesses have to close. We can actually have some semblance of normalcy. Just wear the mask.
Yeah. You know, it's interesting. I've had people say, well, this is really confusing, but I think the point is not having people over to the home, trying to limit our teenagers' interactions, which is next to impossible to, keep them at home and not hanging out with all their buddies, because that then spreads through the family. So I think we're all going to have to work on it. It's tough.
I know this is kind of a tough question, but it seems like every time I go to the store, there's always somebody who's, I'm going to give a little visual aid here. You see my favorite, I'm wearing my mask. It's a nice chin rest. Is this a case where we have to kind of screw up our courage and start telling people in public, hey, could you pull that up a little bit?
I have a pretty assertive personality, but I think the only thing that we can control is ourselves. You know, certainly I think in the work setting, if you have a colleague that has, made the decision to pull the mask down around and is putting other people at risk, I think it's totally appropriate to say something in that setting. I don't want to see our employees going out and getting to like battles with people because they don't have their masks on. I would just simply remove myself from the situation. Or if it's uncomfortable enough, have a conversation with the manager at the setting or leave. I really think it's the place of business responsibility to make sure that people are abiding by the executive order.
Where can we go for information on the new mandate?
So coronavirusutah.gov is the best place for us to continue to get guidance if there are any other questions. And of course, people can ask and tag us and we can get answers and do another BTV podcast or...
Absolutely. Well, we have an operations update coming up next week. We'll be recording on Tuesday a whole slew of operations updates, which I'm sure COVID will feature in. So if you do have questions, please address the VINI podcast channel on Slack, and we'll make sure to add that to the operations. I know you have council update today, so I'll be talking with you later. Becky, thanks so much for joining us today.
All right. Thanks, Lee. Have a good day.